Okay, looks like I am recording this, so we're going to get going. So thanks for coming on. Our accreditation standards, it's Kathleen Carrozza, the DI director, and our accreditation standards do require that we do regular preceptor training. So this year I thought, since we were implementing some new systems, it would be good to train people on what our program is doing and how different preceptors and different people participating with our program kind of fit into the big picture. So the first kind of exciting thing happening at the college is we got a very large bequest to expand our footprint in life sciences. A biology alum graciously donated funding, and at her passing, she had already donated funds to do some upgrades to the bio labs, and then the gift that she left on her passing was to implement some new programming in the health sciences. So the college has had a long history of a foods and nutrition program and a nursing program and a strong clinical psychology, or psych counseling, I should say, program. And with this bequest, we've been able to renovate this summer several spaces in Henderson Hall, which is the hall which is actually the building where foods and nutrition is located. So the lower picture here is actually second floor, and it's a nursing assessment lab. So it looks just like a little ICU, but then has a desk for roundtable discussions and some smart classroom work. And over on this end of it, there's a separate little room that will be a sim lab with mannequins and the simulated patient ability to work for faculty to work with students with simulated patients. The physicians, so that's going to be a 4-year generic nursing program. So in the past, we've had an RN to BSN program, so students who already have their RN could come finish and do their BSN. So it was really all coursework, no clinicals, because they already did their clinicals. They're already RNs. So now this will be, they're working on, actually it's accepting the first level of freshmen, and there may be some transfer students, so it'll kind of fully launch next year. But in preparation for the PA program starting, this work has all been done this summer. For the PA program to get started, so the Master's in Physician's Assistant, it's a 2-year accreditation process, and part of what they have to demonstrate when these site visitors come is showing the physical space they're going to be able to use. So in addition to the nursing assessment lab, there are, this is actually a sim lab in the downstairs of Henderson Hall, which is going to be the PA wing. And again, there's 2 sim labs, and there's the window with computers for faculty to look in. And then there's, I think it's about 8 exam rooms. So these rooms are set up like an outpatient room. So the exciting thing about that is that for foods and nutrition, with the college expanding the footprint in health sciences, we're going to be able to do some more interprofessional training and partnerships. So there's an undergraduate program in social work, the generic now nursing program, the traditional RN to BSN, a PA program, Masters of Public Health just got launched, and the counseling psych program. So we'll be able to do some work with those other departments. And then we also may be able to offer some other types of training for different groups of professionals. So maybe we would decide that we want to do a continuing ed program in nutrition-focused physical assessment or that kind of thing down the road. So we're going to have a lot more capability for those kinds of programs and interprofessional work, and also training. In order to kind of expand our footprint in healthcare, the college has, at a higher level, from the upper level administration, been working with organizations locally and others, but specifically Atlantic Health, and that's where the dietetic internship is developed, a partnership for the inpatient clinical training. Grow It Green Morristown is a local urban farm. It's the largest urban farm at an elementary school. It also operates a community garden and a mobile food market, and they operate the greenhouse on our campus. So they are now renting the greenhouse, which has been on the campus for years. It's in the Shakespeare Garden, but it used to really be supporting, many years ago, a botany program, which we haven't had for a while. So we're looking at ways that the foods and nutrition students can be working with Grow It Green, and we already have a lot of undergrads who do some volunteer work with them. Zufel Health Centers is a community clinic company, organization, I should say, a nonprofit. They do lots of great work in this area. They have 8 centers. One of them is a mobile center, and our students will also be able to work with them, and we've been working on some other program partnerships as well. So, clinical faculty preceptors. So we are operating with this new format where all of our interns have a week of orientation together, and then half of our class will go into a clinical rotation, and half of our class go into management, which is very traditional for us. The half that are going into the clinical rotation will do a 2-week prep class, and then they do 7 weeks of inpatient med surg and nutrition support, being supported by our new clinical faculty. So Nadine Grant is our full-time clinical faculty at Morristown. Nadine, they're all 3 alums of our internship. Nadine is finishing her master's this semester. She has a background most recently in renal, but she's also worked in rehab and in acute care, and has been doing consulting in long-term care. Robin Gould has been working primarily in wellness and retail, as well as in acute care. And she's finishing her master's here at CSE next year. And Winnie Hood has completed both our internship and the master's here, and she's on with us today. Hi, Winnie. And so Robin and Winnie are job sharing at Overlook, and Nadine is full-time at Morristown. So the clinical faculty will be training interns in small groups of 4 to 5 students and acting as the primary preceptor for them. And they will be really coordinating, evaluating, and supervising their inpatient experience. They will I'm sorry, my phone was ringing. They will also help us with some of the outcomes type things we have to collect, outcomes, student learning related outcomes related to the curriculum, helping us with some revisions if we need to for the curriculum, participating in other department and DI activities. But their primary responsibility is going to be working with students. So in the fall, we have, this year we have 17. Normally we have 16 students starting. And so they will do 7 weeks of training at one site. Our interns who start in management do 6 weeks of management, a week of community service, so that's 7 weeks, and then they do 2 weeks of clinical training in a class before they go into the hospital. So for the fall semester, the clinical faculty will have 2 cohorts of students, one at Morristown and one at Overlook, and then we have 20 students starting. This year it's 19, but it's typically a class of 20 starting in January in supervised practice, and it's the same thing. So our students who start in actually next week in August are in our entrepreneurial nutrition practice concentration, and the students who start in January are in our community and public health concentration. So why did we start this clinical faculty model, and what were we thinking about? So as most of us know, the national match rate is still only at about 50% for the last decade. So we know that we need more internship positions, and even as we've added more internship positions, we've seen more students getting their DPD degree, their undergraduate degree. In New Jersey, in 2015, when we had our site visit, we had to write a self-study, which is basically a large report about how our program's operating and meeting all the accreditation standards. And we had to identify what were some of the challenges for our program, and as well as obviously the strengths. So one of the challenges is in New Jersey in the last 15 years, there's been about 10 hospitals that have closed. We also saw more and more that the preceptors were under pressure to increase their productivity. So, we're seeing hospitals with anywhere from a traditional seeing at least 12 patients a day to seeing at least 18 patients a day. And now dietitians have taken on diet order writing privileges, nutrition-focused physical assessment, and more support of identifying and treating malnutrition concerns in the hospitalized patient. So the clinical training requires a lot more one-on-one time with the students than some of the other areas of the profession. So in the community and in the management rotations, oftentimes people see the students as additional help, additional support. They are able to have the students do projects and implement programs that they don't necessarily have time to without as much one-on-one supervision. As we moved our program from 18 students to 20 students, it got harder and harder to really schedule those students for acute care. It wasn't so bad for some of these other rotations, but in acute care, it was a challenge. So the other concern that I had was, as the director, I saw more and more healthcare organizations in New Jersey merging. So we're all aware of, you know, the Meridian Health organization, that, you know, group now has most of the hospitals like on the seaboard, and then we have, you know, along the coast, I should say, and then we have Robert Wood Johnson Barnabas merger. And so for us as a small Catholic college, the concern that some of the larger institutions in the state might develop singular sponsorship agreements was a little bit concerning. I mean, I could really see the writing on the wall that a large university like Rutgers might want to work and partner specifically with an organization like Robert Wood Barnabas because of the relationships with medical schools and et cetera, and all their different programs. So that was a little bit in the back of my mind as well. I had been exposed to and heard about a couple of other programs who do this clinical faculty model. So it's a hired clinical faculty. They're paid clinical faculty who are college employees and have rights at the medical centers to be there teaching the students. So the college started expanding its relationship with Atlantic Health because of the proximity to the college of both Morristown Medical Center and Overlook. And because of these other programs coming on board at the college, you know, they've been at the higher levels working with, okay, would this make sense for us to get a stronger relationship? And Atlantic Health has been very supportive of working with the college, and the college is also providing things like, you know, working with them on space for some of their training events, and thinking about how we can use our sim labs and other training facilities now to partner with them. So we hope it's going to be a very strong, mutually agreed upon relationship. In order to be able to hire faculty, we had to increase our enrollment to help support that financial investment. So we went from 20 students and we went to 16 in the entrepreneurial, because that rotation was a little bit harder to get the rotation sites for corporate wellness, and expanded the community and public health, because our observation was that in the community, so many programs are struggling for help that we could probably find placements for that as well. Our program is ACENT accredited, and it's in the current dietetic internship program model. We're considered a combined master's in nutrition internship. So we have 20 credits of master's coursework. So we require the coursework, but the coursework itself is not accredited by ACENT. Only the internship portion is accredited. The accreditation standards outline 10 areas of program management that we're responsible to make sure we are functioning. And it's things like that we have mission and goals and objectives, the student learning outcomes, that we post correct and easily accessible and transparent information to the public, that we collect outcomes data on our program as well as on the student learning outcomes, which are these 41 competencies. So we have 41 competencies called CRDNs in 4 domains, and we also call them student learning outcomes. So we have to document how we achieve both our program outcome goals and our student learning goals. So we have annual reporting that we do at the college, and then we have a 7-year now cycle. They've changed the cycle. It used to be 5 years and 10 years, you know, a 5-year report, a 10-year site visit. Now it's a 7-year site visit. So we have a 7-year accreditation process. So you've probably heard about this future model, future model, future model, and this whole idea that the programs have to be at a graduate level. So for someone to run a future model program for a dietetic internship, a student who's completing both a graduate degree and the supervised practice, it's actually going to be called a graduate degree program. So you can title your graduate degree program Master's of Science in Nutrition, Master's in Dietetics and Nutrition, Master's in Public Health. What you title the graduate degree program is up to you, but it has to be a graduate degree program. Right now, there are 3 programs approved to accept students in this future model. UNC Chapel Hill, and I'm going to mention them again later because they're the group that started this PRISM that we're going to be working with. Hunter College, which already had a master's level program, I think combined, or I don't know if it was combined or coordinated, and Rutgers. So Rutgers traditional internship is running this year, but Rutgers is approved for the future model, and it's my understanding that they transformed the DTR program that was a BS, people who had a DTR could earn a BS and verification. So it's my understanding that they've kind of transferred that into their graduate degree model program, and now you have to have an undergrad degree. If you remember back, if you're old enough to remember back to what we still had, there's still available what we call coordinated programs, but they kind of waned in popularity for a while. So the coordinated program was always a program that integrated both knowledge and skills, but they were traditionally at that undergraduate level. So this is similar to that. So both students' knowledge, so the coursework they take, and the skills they achieve, the competence, are assessed. So both the didactic learning and the supervised practice learning are integrated. So the idea of the future model will be that you're really supposed to be doing didactic learning with supervised practice at the same time or somehow integrated. So therefore, the accreditation is now of the entire program. So programs will decide what they want their prereqs to be. So some programs might decide you have to have a bachelor's degree with an undergrad verification, and some will say you have to have a bachelor's degree and you have to have these prereq courses. Now, of course, we all know that if the prereq is nutritional biochem, you've also had to have had probably, if it's biochem or nutritional biochem or advanced nutrition, you've also had to have had those other courses. But you won't have to necessarily have a DPD verification that includes all the courses that we now consider requirements for a traditional undergrad. So it's going to be a lot different, because each program will have to assess each applicant, which is what's happening now at an undergrad level if a person's a change of careers. So programs will develop their own admissions processes, and they won't be using that centralized application process anymore. So when is this all going to happen? Honestly, typically these kinds of major changes can take almost 10 years to be required. What happens right now is every 2 years our accreditation standards are upgraded, and we have to make changes based on any changes in those standards. So if they change a competency or change a program requirement, every 2 years we have to review the new standards and we have to make a change. A lot of times programs choose to make a major change when they're having their actual site visit and self-study report, so that you're kind of doing it all once, because whenever you make a big change like this, you have to submit a large report that documents how you're going to implement all the standards, similar to the report you have to write when you're having a site visit. So I would not be surprised if the college chooses to go this route when we have to do our next accreditation in 2023, which seems like a long way away, but it's actually not that far. So I would anticipate between 5 and 10 years these kinds of changes happening. So in our what we call a combined master's internship, our students are taking 20 credits of online master's coursework before they start their internship. All the students, whether they're in our EMP or our community concentration, so our entrepreneurial or our community, do these core courses. So they all have a child and adolescent nutrition, a health promotion and aging, so hitting different aspects of the lifespan. interventions and strategies for weight management, focused heavily on the research in weight management, advanced nutrition and metabolism, and research methods, and that, program planning or program design and management and community nutrition. So all of our students during their first year in the program do this course, which is kind of our like toe in the water of trying out this idea of a course that incorporates supervised practice hours and kind of trying out this new method. So students in this class spend the first half of this semester learning about program design and management in the community. Our new faculty, Dr. Beth Conlin, who's also an alum, this is her area of research and interest. She's teaching this course, and the students identify a program they want to work with and develop a program during the first half of the semester, and then they implement it during the second half, and they document their 80 hours of supervised practice in this coordinated format. The other courses they take in their concentration, so our entrepreneurial nutrition practice concentration focuses on wellness counseling in corporate wellness settings and supermarket. So students choose whether they want to take the integrative health class or the sports nutrition class. So obviously if we have students who are very interested in becoming sports dietitians down the road, they choose that. A lot of students who are interested more in a holistic method of treatment and thinking about private practice down the road might choose the integrative or even supermarket, because it's a lot more on the integrative therapies, but also on herbals and other types of integrative therapies that students would come across when they're doing nutrition counseling. In the community and public health area, they take an intro to public health class. And Dr. Boyle teaches that, and she's considering adding an element of that of supervised practice as well to test it out. So we will have to see how that goes. The first round of students doing the integrated supervised practice last year really liked it, and they gave a lot of positive feedback. So you know, in the end, this is a really great way for students to learn, because they are learning, and they're learning and doing at the same time, which sometimes is a more solid way to acquire skills, both knowledge and skills. So once they finish their coursework, which is a full academic year, they're going to have an orientation, and then when they're in their clinical course, they do 2 full-time weeks of a simulation class. So they're using a simulated electronic medical record, using patient cases, and they're just practicing, assessing patients, writing notes, writing PES statements, and they're really trying to hone their skills so when they get to a hospital, they're not completely unfamiliar with what they're looking at. And so then they do 7 weeks with the clinical faculty, 4 in med-surg, 3 in nutrition support. The additional clinical training that they do, so for those of you who might be on this training who are in extended care facilities or outpatient facilities, then they would do 2 additional weeks, 1 in outpatient and 1 in extended care. So we're hoping that by that time, the student is operating with you at a more independent level than their entry-level clinical would have been. And of course, it's a different setting, so there's different aspects they have to learn, but we're hoping that they will be a little bit more prepared for you. And so the students were given an option for outpatient to tell me whether they would like to do, they were given a preference list. So they had to give me a preference of either diabetes, renal, they've actually ranked them. So diabetes, renal, a clinic, in which case they have to be bilingual. And the other choice was, I just want to be closest to home. So for our clinical rotations, they're driving to Morristown or Overlook. Depending on where they live, I tried to place them at the site that was closer for them. And then for outpatient extended care and other rotations, they're much closer to where they live for the most part. Some of our students live in very rural areas of North or South Jersey, and so then they're kind of used to driving no matter where they are. For extended care, they were given the option of rehab, long-term care, psychiatric, LTAC, developmental, both adult or children, and also the idea of just closer to home. So we've been really fortunate to be partnering with so many different DaVita facilities and Fresenius facilities and diabetes centers and so many long-term care organizations. We brought Greystone on this year. The LTAC is at Monmouth South, Southern Campus, and there's a couple of developmental centers still open in New Jersey, and Matheny, which is a school and hospital. So those are the types of places they'll go for that other clinical rotation, those other clinical areas. We also do training, which is a little bit different than other programs in professional communication. And so all of our students are going to be receiving training in motivational interviewing. In our entrepreneurial concentration, it's in concert with their time at a corporate wellness site over 5 weeks. In the community concentration, it's going to be done in a more concentrated group dynamic, and then they'll be using some of those techniques when they're working more one-on-one with students. But we also do some exposure to professional social media, food demonstrations, public relations, and public policy as part of that whole rotation in professional development. The students also still do a 2-week culminating experience full-time, and they do simulated hours with cases in child nutrition, WIC, and cultural competence. And you can see the credit assignment is kind of related to the number of hours they do. It's about 60 to 80 hours per credit. So now PRISM. So PRISM is a management system, an online platform used by all the types of people who manage dietetic interns. So preceptors, interns, preceptors, instructors, students, and overall management. And each different audience has different functionalities in PRISM to actually participate in PRISM. So I'm going to show you some of those different slide screens, and anyone who's on this call, I will email you this set of slides, both sets of slides, the information about the the continuing ed certificate, and a reminder of how to get into PRISM. So PRISM basically is an online management tool. It's very much like an online classroom, but most colleges' online classrooms don't allow for outside people to get in. So while we use Moodle for our online classroom, I can't get my preceptors to be able to sign into Moodle. For PRISM, I can get them to sign in. So I think the hardest part about PRISM is getting this URL down and saving it as a bookmark so that it's long, so that it's easy to get in. So I will send you this as a separate link to remind you how to get in. Once you get in and you'll have this set of slides, you're basically going to put your email in and click on forgot my password, and then it will let you set up it will basically let you set up your email. Melissa Walter is the faculty. She's a dietitian. So this is the University of North Carolina Chapel Hill's internship, which is a coordinated, well, now they're going to be in the new model, but they've been a master's level public health internship. And they were trying to figure out what would be a good way to manage all the data we have to collect about students and use less paper and provide access to our preceptors and everybody involved. And they worked with their IT department to develop this. So last year, I think it was Sylvia Escott Stump's program and our program signed on, and a few others. And I really just started getting my head around the program. We didn't really start using it. But now we're really going to start implementing it. And what's been good is that any problems or questions or concerns or challenges that I have had, I bring them to Melissa. She brings them back to their development team, and they try to address them. And she always seeks the input of all of us as she's making those changes. So she is available for questions, but you could definitely email me first. And if I can't figure it out, then we can go to Melissa. So since you'll be a first-time user, you'll say forgot your password, you'll set it up with you'll get an email link to set up your password, and then you can get in. And you'll see that you're going to have a profile, your students, and then there's some other navigation bars up top. So if I show you, oops, this is what a preceptor slide would look like. So I put in a fake preceptor myself and a fake site, Savor and Stroll, which is my current little walking tour business. And so it's showing that me as a preceptor I have 2 students scheduled. I have one in August and I have one in September. And when I view that rotation, I'm going to see anything I have to do regarding that rotation, action items. So if I had an evaluation to do for the student, it would show up here. If there was curriculum for me to look at, it would show up. And here's the curriculum. So I could say, oh, what's the curriculum for this rotation? So as the preceptor, you can put a photo, you don't have to. You can put more information, you don't have to. But at the top here, you would have your profile, and then you would also be able to click on the students you're going to be seeing. So I'm going to have Kate the Great, and I can view her, and now I can see who she is, any information about her. I see her rotation schedule. I see her curriculum for the unit, and I can also see anything that's in there that I might need for onboarding. So I'm only as a preceptor for or as a person affiliated with the Savor and Stroll site, I'm only going to be able to click on things affiliated with me. If I was the dietitian at Foothills Rehab, I'd be able to click on that. But I can only click on the ones that have to do with me, but I can see where else the student went. I can see she's doing her entrepreneurial at CNBC and her outpatient at DeVita Mountainside. So I get a little bit more of a sense of this student. And so that's kind of how the preceptor's form will look. It will give you a way to manage the student electronically. So anything you need for that student is going to be there electronically. Now, if I was the student, here's what I would say. So this is Kate the Great. I have my picture. That's me for my 50th birthday. My husband took us hot air ballooning, and I love that picture. And so I was like, I'm going to use that picture. And so here I am. I am the student. These are my rotations. If I want to look at, if I want to look ahead and say, what am I going to be needing to do for entrepreneurial? I'm going to need to do that soon. Let's say outpatient, because that one will show here. So now I go down and I say, I have my unit here. For any unit that needs a certificate of insurance, it's also going to show up. If that unit needs medical or background clearance for the student, it's going to show up. For the student, they also see, I have to do a journal for this. I have to do a journal entry for this. And if there was some other homework they had to hand in, it would show up. And if there was an evaluation they had to do, it would show up. So the students will be able to see where they're going and manage also their own assignments electronically. So we're really basically saving an awful lot of trees this year. For me as a faculty running the program, I see these kinds of screens where I can see all the other things I need to add in, all my rotations, all my users, preceptors, and students. I kind of see, oops, it's telling me I was out of it for too long. I can see all the students, I can see all the preceptors. So for me, I'm seeing different things. So each group that uses it sees what's applicable to them. So as a faculty, I can see the students and what work they have to do, and we can go in and grade it. I can go and say, okay, this student needs to have this form, this evaluation filled out. So for example, for our management, for our faculty preceptors, rather, for our preceptors who are precepting a management rotation, well, this is Jessica at Morristown, is going to be supervising Brittany Brockner for her management rotation. At the end of her management rotation, she can go in and look at Brittany's eval and say, oh, I need to do this evaluation for Brittany. And the evaluation is all online. And so the student really didn't observe, they didn't observe the student. The student did it okay, but needs improvement. This is where we hope most students will be, that they're performing satisfactorily. Maybe they need some guidance, but they're performing it. And this is where, we hope students move to during the program, and this would be that exceptional student. So most of the students hopefully will get these 3s and 4s. If they get 2s and 1s on their evals, then I, as the director, would go in and kind of identify where is the problem for this student, and I have to figure out another way to measure whether this student has achieved this competency. So this system allows us to take all 41 of the competencies that we have to demonstrate our students are achieving. So these 41 competencies are addressed in different ways in the program, but we decide where are we going to measure it. So some of these competencies, we decided we should measure these in the management rotation. So for example, applying leadership skills to achieve desired outcome. Well, that could be in, that could be in different kinds of rotations, right? It could be in a community rotation where they led a project. We decided the easiest place to measure it was specifically on theme day. So we're asking the specific question, was the intern able to demonstrate leadership skills in theme day? And so we're giving guidance to how we think we want to look at this skills competency for someone to measure it. So for every competency, we have to measure it for a specific assignment or activity. So in the final clinical evaluations, we would be looking at, at other skill sets, like are they able to, that's a billing and coding one. Are they able maybe to, perform the nutrition care process? We would be looking at other things. So again, Brittany here for the final clinical, so this would be done by our clinical faculty. Okay, could they function as a member of an interprofessional team? So in other words, were they able to talk to other members of the healthcare team using the guidelines? So for those who are in our outpatient or our extended care preceptors, you would not have this kind of evaluation. You might have a paper evaluation for, just like we used to have for the unit. For example, if I look at, because I think I do have an extended care person on here, I would say this is the unit, and there would be a form here for an evaluation as well. So we have to load some more of this in here, but it's going to be pretty, you're only going to be seeing what's applicable to your rotation. So in that way, it will be easy to understand what you need to do next. So those evaluations that we're doing during student progression, such as weekly unit evals, is one way we're evaluating students. We're also doing homework grading with rubrics, and then we're doing those summative evaluations that are on PRISM. And the beauty of PRISM is that data is then going to be aggregated for me electronically. So just like when you do a Survey Monkey survey and you get your results in nice little charts and numbers and percentages, that data will be able to be pulled in that way. So I can pull reports instead of having to hand tally things, which is what we've been doing. So in the past, every year, for every student, we've been hand tallying the information for all 41 competencies. So this is going to streamline the evaluation process. Again, the format of the evaluations, we're really looking that they can do it satisfactorily, but they might need help. They're entry level. They don't need to be 100% independent on everything. So for my preceptors online here, there's a couple of other ways that you can get continuing ed credits. If you look at the CDR website, oops, sorry about this. I'm just going to open it. It opens it in Internet Explorer, which doesn't always work as well. But so if you go to the CDR website, which is cdrnet.org, and you just search in the search box Preceptor, that's the easiest way to find this. I have not been able to find it any other way. So, oops, when you go to that, you see CPEU credits for preceptors, and you see online preceptor training. This online preceptor training course is 8 credits of continuing ed free, and it's set up in modules. So you can do a module at a time, and I believe you have to check when you open it that when you start it, you can also save it and go back to it, that you don't have to do everything at once. I would verify that, but it's a great way to get 8 continuing ed credits, and it does really cover a lot of good information on precepting. So I highly recommend if you haven't already done that. The other thing that you can do is to get credit for being a preceptor, and I have those documents here. So over the last several years, the Nutrition and Dietetic Educators Practice Group has really been trying to convince CDR that preceptors learn from precepting. And for years, we had this leadership component to earning credits for being in an elected position with the association. And so there was a great task force of people who convinced CDR that preceptors should fall in this same idea of professional leadership. So either with an elected position in the association at the state or DPD or national level, or by precepting, you can earn credits. You can earn a maximum of 3 per year and a total of 15 over your 5 years. So you can earn 15, but not more than 3 a year. So, and it's basically designed on keeping track of your hours. And then I'll show you the form. This form, what you have to do is you describe what you did when you precepted, how you felt precepting impacted your practice, what changes will you make in the future as a preceptor as a result of your experience, if any, you know, a small description maybe, and then you fill in your name and then how many hours you did. So if you're a preceptor for us for 40-hour outpatient or extended care, you can earn 2 credits. If you're working with more than one program, you could get 1 filled out for me and 1 filled out from somebody else, but you won't be able to earn more than 3 in a year. But you can earn 3 per year for up to 15. So you basically fill this out and email it to me, and then I complete, you know, you can put my name in or I can put it in. I have to put in my signature here, and then the institution, so College of St. Elizabeth Dietetic Internship, College of St. Elizabeth, and then I send it back to you to sign it and date it. So that in that way you can earn credits for being a preceptor. So I really hope that people consider that option, because I think it's something that is a benefit to everybody that wasn't always available. It's kind of new, so people who've been precepting for a long time might not even realize it. It just started last year. So I think that what I like to do next is I also wanted to point out that these are the learning codes, and this was on the original document that was emailed, but I will send this out again as well. So these are the learning codes if you're under the old training format that this program has been approved for, and these are the learning codes for the new format of continuing ed. I wanted to just say, if anyone wants to unmute and ask any questions, to feel free at this point, or if you don't have any questions, Then what I'm going to do next is anybody who participated, I had about 17 earlier today, and there's a couple of you as preceptors today and a few of our staff and faculty. So what I will do is email you. I'm going to email you the information about what this counts for credits with your, with the continuing ed certificate. I will email you a copy of the PowerPoints, and I'm going to just say, here's the link to go into PRISM. And the other thing about PRISM is you will see the student information when you actually have the student. So you'll be able to see who's coming to you, but I believe if you click on that student, no, if you click on the student, I'm sorry, you'll see the students that are coming to you, and then if you click on your students, you'll also be able to see any onboarding documents as well as any other information about them. So this is our first year trying this, and from what I understood from one of the renal regional renal managers, it sounds like there's a couple, and I also heard this from another preceptor. It sounds like maybe Rutgers is trying this year, or another program in the state. So hopefully, as more programs transition to this kind of online system, it will be easier for everyone. We're doing our best to try and get it fully implemented this year. If you are completely overwhelmed and you want me to email you any documents, I'm happy to do that. We're just hoping that over this year we can transition people to feeling more comfortable with it, and then it will then eventually streamline the amount of paperwork. And I think once people get comfortable with it, and since more people are doing more things online, I think people will be more comfortable. This is a secure system from UNC. It is, it is, I guess, as secure as internet systems can be. And honestly, I think it's more secure than sometimes when I was mailing medical records through the mail and I don't know who got them. So while, I did have a few times where people got them who weren't supposed to get them and contacted me saying, I wasn't supposed to get these. So I'm hoping that people feel comfortable. And if you want to email me any questions, feel free. But otherwise, I will go ahead and email all of that info to you, and you can feel free to just kind of close out or unmute and ask questions. I'm going to open, where's the chat box? I'll open the chat box in case anyone if anyone has a question, you can also type it in the chat box. Okay, I don't see any questions, so I'm going to go ahead and close out, and I really appreciate everybody participating, and we look forward to keeping working with everyone.